Hi and welcome to the Bowen Technique YouTube channel. We have some requests to look at the elbow and the position of the elbow, so this afternoon that's what we're going to do. And we're going to go through where it is, but we're not going to put in the moves themselves. I don't think it's the right format is to put Bowen moves on YouTube. But we'll show you the anatomy, show you where everything is, and how to find some things and a couple of tricks to play. So I hope you enjoy it. So first move we're looking at is 3 fingers down from the top of the shoulder, and this is the mid-deltoid. And we've dealt with the posterior deltoid in our shoulder move and the anterior deltoid in our shoulder move as well. And the mid-deltoid is one of those things that we want to make sure that we're going to get. So we're going to use the middle finger. Next thing we're looking at is when we're going to come up is we're going to hold underneath. So it's what we refer to as our 6 gun. So the reason being is we want the underside of the arm, the forearm, to sit onto our fingers. And the thumb comes along and can sit onto the extensor digitorum communis. I'll put a lot of this anatomy over the top so you'll see what's going on over my voice. If we're not sure where this is, I can get my client to wiggle their middle finger. So just wiggle that middle finger, that's it, lovely, and I can feel that underneath my thumb. That's my second placement. The third is just underneath here. So if I come underneath here, now there's a few arguments as to what is underneath here. So we'll call this the triceps tendon. So coming down here to the epicondyle here, we can feel this little lump. If I just come above the lump, that's going to be the position of the epicondyle. Now, as to the position, the direction of the move here, it's a bit of a tricky one, because what we tend to talk about is outwards and inwards as for the elbow, which makes it a little bit easier to talk about, because if we are talking about it from an anatomical perspective, it is a posterior move, this third move. From here we've got our holding point, and the holding point is very easy to find if you follow these principles. So 2 fingers to the French. So 2 fingers come down the inside, down the inside of the arm until we end up with this epicondyle that we've just found sitting directly between the fingers. So if those fingers come down, the thumb can then reach around and it can locate the joint between the end of the radius, the head of the radius, and the end of the humerus. This is the radiohumeral joint. Now, if I open the arm right out, move the arm backwards and forwards a little bit, I can feel this little joint. This is the radiohumeral joint. The secret to this, to finding this, is to keep the fingers pointing to the ceiling at all times, and then the thumb just reaches around. So move the arm around to get yourself in the right place. So we hang on to that for about 10 or 15 seconds, and the idea is we're trying to create a numbing through this joint so that when we come to do the elbow move in a minute, it becomes a little bit easier. Okay, so yeah, 10 or 15 seconds, or until somebody feels any tingling or sensation. The moment anybody feels any tingling sensation, that can be coldness, numbness in the hands or the fingers or anything along those lines, buzzing along those lines, then stop, because you don't want to damage the nerve. Let's have a quick review of that. So the first one here, 3 fingers down, mid-deltoid, extensor digitorum communis. So digitorum always refers to fingers. Tricep tendon just above the epicondyle there. Then we have our tripod down the inside of the arm, either side of the epicondyle, thumb into that joint. Then lastly here we've got the base of the wrist. This is the last actual move that we've got, the base of the wrist, and we have the retinaculum, the extensor retinaculum that comes across the base of the wrist. And it doesn't really make any difference which way you move, if you move one way with your thumb or the other way with your thumb, but in this instance we're going to move towards the thumb with our extensor retinaculum. From here, what I can then do is I can give a little stretch. So if I put my fingers at the back of the wrist and the thumb sits onto the top, onto that retinaculum just beneath the bones of the forearm, then the rest of the fingers can sit in the palm of the hand. So if I turn the hand around, yeah, you can see what's going on there. The fingers at the back of the wrist, the rest of the fingers in the palm of the hand, and the thumb sitting onto the top, and then I can draw that stretch in. Yeah, there it goes from there. Once I've got the stretch, nice little rotation, get the wrist rotated, round and round through a figure of 8. Don't let the wrist drop down. We don't want to compress into the flexor retinaculum that's under there. That median nerve comes down through the underside of the wrist. You do not want to push backwards. That's something that could damage that wrist. You don't want to do that. So as you're rotating it around, keep it level, and then we can give a little flick and a pull. I'm not doing it here, but it's just showing you what's going on. Okay, have a stand up for me, please. So what's happening now? Just come to this, get the camera over here a minute. So now what we're going to do is we're going to do our snake. So the first thing is I want the elbow in, as far in as it can go, and the hand is face down. So as that elbow starts to extend outwards, it turns on the move. It's a constant turning. So it's going from a sort of pronated position to a supinated position. So this is the movement. We're extending and turning as we go, and I'll do this with somebody 2 or 3 times before they then try and do that themselves. So it's a constant turn. So then they can actually flick that out, and that can reset that joint. Don't let them, because what's happening here is the radius and the ulnus is twisting over on itself. So don't let them go home and do this as an exercise. They can do the extension as an exercise, but they shouldn't do the snap out as an exercise. That should be only done under your supervision. The moment you hear a click on this, that's it, job's finished. So this is what we're talking about as far as our holding point is concerned. We've got the epicondyle, and I'm trying to get my fingers to come down the inside of the forearm so that these fingers will sit either side of this little sticky outy pointy downy bit, to be technical about it. The thumb then comes along and sits into the little groove between the head of the radius here and the end of the humerus, the radiohumeral joint, and that's where my holding point is going to be. So that's the elbow. Hopefully you know what to do from here and the locations for that, and I hope that's been you found that useful. If there's any other requests you have, or there's anything you want to see, or any comments you have, then please make them below, and enjoy. Thanks very much for watching.